Hereditary spherocytosis, abbreviated HS, is a rare inherited hemolytic anemia caused by autosomal dominant disorder that defects in the red cell membrane. Normally, RBC consist of specialized cytoskeleton such as Ankyrin, spectrin, actin, band 3 protein, band 4.1 and band 4.2 protein on their plasma membrane that allows it to fold and squeeze through microcirculation like splenic sinusoid or capillary. Pathogenesis of HS followed by genetic mutation, that most likely occurs on Ankyrin, spectrin, band 3 and band 4.2 protein, which cause affected erythrocyte to lose their stability in morphology. Which means young HS red blood cell are normal in shape, but as they age, they undergo loss of membrane fragments in the circulation, and formed into spherical shape which is rigid and inflexible. Large amount of spherocyte would get trapped inside the spleen, then soon after clear out by monophagocytic system prematurely less than 120 days, leading to shorten the lifespan of RBCs and triggered anemia to occurs. Sign and symptom include anemia that result fatigue, weakness, shortness of breath, pallor, headache, and lightheadedness. Jaundice, due to unconjugated hyperbilirubinemia. Dark yellow urine, due to increased urobilinogen in the urine. Reticulocytosis, is due to increased RBCs production as bone marrow responds to anemia. Splenomegaly, is due to spherocytes are sequestered inside the spleen. Complication of HS include aplastic crisis and pigment gallstone. Diagnosis usually depend on family history and laboratory finding, which include complete blood count shown, low in MCV but raised in RDW, MCHC, and reticulocyte count. Blood smear, shown, small hyperchromic spherocytes RBCs without any central pallor. Biochemical finding, shown, elevated serum bilirubin and plasma lactic dehydrogenase along with hemoglobinuria, hemosideruria and high urine urobilinogen, but decreased in serum heptoglobin. Negative direct Combs test also helps to distinguish from acquired immune hemolytic anemia where it is positive. Positive osmotic fragility test, it used to measure erythrocyte resistance to hemolysis while being exposed to varying levels of dilution of a saline solution. When erythrocytes are exposed to a hypotonic environment, water enters the cell and causes swelling and eventual lysis, that why it's shown right shifting of the curve on patient with HS. Treatment of HS usually done by total or partial splenectomy procedure, to decrease premature destruction of RBCs inside the spleen. Folic acid supplement, recommended for under 5 years old patient to increase healthy RBCs production in the bone marrow. Blood transfusion may require in some cases, like aplastic crisis when parvovirus B19 infected erythroid precursor within the bone marrow. In summary, hereditary spherocytosis is an autosomal dominant, that mutation involve Ankyrin, spectrin, band 3 and band 4.2 protein that causing RBCs to become spherical shape which is called spherocyte, and most of it will be trapped inside the spleen, leading to premature destruction. Decreased total circulated RBCs by premature destruction is responsible for anemia that result fatigue, weakness, pallor, shortness of breath. Splenomegaly and jaundice along with other complications include pigment gallstone and aplastic crisis. Diagnosis could base on family history and laboratory findings such as CBC, peripheral smear, biochemical finding, and osmotic fragility test. Partial or total splenectomy procedure may perform on HS patient to decrease excessive extravascular hemolysis within the spleen, however the patients would develop post-splenectomy complications, such as abnormal morphology of RBCs in the blood circulation that appear as Howell-Jolly bodies and even increase susceptibility to infection. That's it for the topic. If you find this video useful, please give us a like and don't forget to subscribe. Thank you for watching.